Hello, and thank you for choosing Beaumont. We care about you and your health, and we want you and your family to have a good understanding of chronic obstructive pulmonary disease, often called simply COPD. In the next few minutes, we'll share what you need to know about this diagnosis. It is a good idea to share this with your family as well. Let's take a look inside your body at what makes your lungs work so you can breathe. Simply, the air and oxygen we breathe through our nose and mouth is carried into our lungs by bronchial tubes and air sacs. The bronchial tubes look a bit like tree branches. At the end of the tubes are the air sacs. They look like little clusters of grapes. Technically called alveoli, the tiny sacs allow oxygen and carbon dioxide to move between the lungs and bloodstream. When this system is working, your air flows freely. However, sometimes the system doesn't work, and there can be several reasons for that. One reason is chronic obstructive pulmonary disease, or COPD. That's a term that refers to several different progressive lung diseases like chronic bronchitis and emphysema. Symptoms of COPD can include shortness of breath, wheezing, a cough that won't go away and may produce mucus, feeling tired, especially when exercising or doing daily activities, and tightness in the chest. Basically, COPD makes it difficult to breathe. Let's take a closer look. Bronchitis occurs when the bronchial tubes become irritated or swollen, and often there's excess mucus. Emphysema occurs when the air sacs in the lungs are destroyed. Now less oxygen can reach your bloodstream. Now that you understand how COPD affects your body, let's talk about the treatment options.
During your hospital stay and after you are discharged, your team of doctors will treat your COPD with medications and close follow-up monitoring. COPD treatment includes using inhaled solutions to deliver medications as a cloud of small particles or an aerosol. If taken properly, particles of medicine travel through the breathing tubes to the smallest branches to relieve or partially relieve the obstruction. This reverses inflammation and relaxes the muscles, decreasing mucus production. For inhaled medications to be effective, they need to be used properly, so the medicine goes directly into the lung where it needs to work. There are 4 common types of inhalation devices that may be prescribed to you. These include metered dose inhalers, dry powder inhalers, slow mist inhalers, and nebulizers. Each one is different in the way it delivers medicine to your lungs. Before you use it, always check the expiration date first. Metered dose inhalers, or MDIs, deliver medicine as a powerful spray that needs to be well coordinated with your breathing effort. Shake it well 5 to 10 times before each use. It is often useful to use a device called a spacer with an MDI. A spacer is a small chamber or tube that connects to your MDI. Then you can inhale the medicine from the chamber without having to coordinate your breathing with only the inhaler. It is important to breathe in slowly. If you need to take a second puff, wait at least 30 to 60 seconds between doses. Slow mist inhalers, or SMIs, are a newer type of device that releases the medicine as a slow mist over several seconds. This makes it easier to inhale the medicine into the lungs. It works similar to an MDI. A slow mist is generated over a period of 1 to 2 seconds as you slowly inhale the medication into your lungs. With both MDIs and SMIs, once you have inhaled the medicine into your lung, it is important to hold your breath for as long as possible, up to 10 seconds. With a dry powder inhaler, or DPI, there is no spray. You have to first load the medicine into the device according to the manufacturer's instructions. Once the device is ready, you have to take in a fast, deep breath to get the medicine into the lungs. Finally, nebulizers deliver the medicine as a fine mist. It is important to breathe in and out slowly and complete the treatment. This often takes 10 to 15 minutes. If your MDI is not fully effective, you can use a nebulizer for more relief. Remember, whichever device you are prescribed, it is important to follow the manufacturer's instructions. If not used properly, the medicine will not be effective. One potential problem with inhalers is that the medicine has to travel through your mouth, your throat, and your windpipe before it reaches the smallest bronchial tubes. Only the medicine that reaches deep in the lungs is helping your breathing. The medicine that stays behind in your mouth and throat is of no benefit and potentially harmful. This is particularly true of inhalers that have steroids in them. Proper inhaler technique with a spacer will ensure that the medication will reach deep into the lungs, opening the branches and allowing improved airflow. Your doctor will ask you to rinse your mouth and throat after you use these medicines. This will prevent an infection in your mouth. Now that you understand more about COPD and medications to treat it, our next video will explain what can trigger a flare-up at home and what to do if you have one.